Anyway, Mary Ellen has been with us for many years. And how long, probably?
Probably about 10 years with you.
10, yeah.
Yeah.
With the group, living close to where we would meet in the conference room. And she'll share with us her experience with medicine, which most of our neurosurgeons here locally also recommend trying medicine first. And if that doesn't work, then consider one of the 5 or more TN procedures. I won't get ahead of Mary Ellen. I'll let her talk about the timeline of her experience with trigeminal neuralgia, which, just as a reminder, in the medical books is called the worst pain known to mankind and called the suicide condition, unfortunately. And unfortunately, Lynn and I have had 2 or 3 in our experience over the years. And there's 2 theories to that, to talk about that openly or not, because you don't want to infer that that's the answer, because it's absolutely not. But one of our members not getting through. Sorry, Melody. I'll talk to her once I let Mary Ellen start. But my belief on that is, if you've had that thought, we've talked about that in our conference room many times. That is a natural response. That's why the medical professionals call it the suicide condition, because there will be days when that's your best thought you can get in your mind, especially those of us that have the constant pain, which mine is more of an atypical neuropathic facial pain from an infected root canal. Many people don't know why they're started. That's another confusing thing. But again, I don't want to talk too much on that issue, but keep that in mind when you're having those bad days due to weather, stress from your wife. No. But Melody, I'll be right with you, dear. Hold on a minute. But anyway, I got to talk to Melody McDonald. She must have trouble hooking up, so I'll help her, Pete. Watch for her, Pete. I'll send her a new invite.
Sounds good.
McDonald. But I'll let Mary Ellen take over here now. Mary Ellen Doutlick from Michigan, Bluefield Hills, Michigan now.
Good evening. Yeah, my trigeminal neuralgia started probably about the same way everybody else's did. I have had it now for about 25 years, long time. I was about 40, 42 years old, something like that. I can't even tell you the exact date, because the first few years when it began, I wasn't sure what it was, and I didn't have it diagnosed right away. It started in the springtime. I thought I needed a root canal, like most of us begin with. It was in the spring, like I said. I went to the dentist. It was around Easter time, and he did an x-ray and said nothing was wrong. I came home, and the same thing the next day. I felt the shooting pains, ran back to the dentist, and I said, take another x-ray. I had worked in a dental office. My brother's a dentist, although I had gone right to the endodontist. And again, he said, there's nothing going on. I said, I have everybody coming to my house for Easter. I can't have this blow up tomorrow, you know. He happened to be a Jewish dentist, and he said, you can come to me tomorrow morning. I will be here for you. You know, I don't do Easter, you know. So I said, okay, you promise, you know. So it did not blow up, you know, and it actually resolved itself and seemed to be okay then for quite a while. I went through that summer, and it didn't act up again until the following springtime, in which case it seemed to act the exact same way. I had a little flare up that spring where I got the shooting pains, and that went on for maybe 3 or 4 years.
So the same tooth, Mary Ellen?
The same tooth, and the first nerve down at the bottom.
First molar.
Right. And then, so that happened for probably 3-4 years. And I really didn't do anything about it. I just accepted that it either was a tooth that was dying, because I didn't know anything about trigeminal neuralgia. I accepted that maybe it was a tooth dying, but it just wasn't showing up yet. So I went on with life. And then it started getting worse. And I started going on the internet myself, and diagnosed it myself, actually. And went to a dentist and said, what do you think of this? And then they looked into it and also said, the tooth is fine. You need to see a neurologist. And at that point, we did decide that, yes, that's probably what was going on. So at that point, without even having any x-rays done, they tried putting me on medication to see if I responded to it. And I did. So just with those two things, they did diagnose me with trigeminal neuralgia. Problem was, even though I responded to it, I broke out in hives from all the typical medications that patients are put on. I either responded with my liver enzymes shooting up or with hives. So I think I was put on either 5 or 6 different medications before I was finally put on one that my body would be okay with, and that was Topamax, which I am still 25 years later still able to take. So I was fine for probably 10 years after my initial diagnosis, very compatible with the Topamax. I did have to up it. And by probably the 10th year, I was then on, unfortunately, 600 milligrams. I started out at 100 milligrams until like I said, I reached 600 milligrams, which was way higher than what they like you to be on Topamax. I think if you look up Topamax, they'll tell you 400 is the top dosage that they like you on. So at that point, I sought help from a surgeon, and they wanted me to have one of 3 options at that point, and I chose an MVD. So with Lynn's help, I went to Dr. Piper, who did an MVD arthroscopically, and that's what I chose to do. My MVD was successful. I was thrilled with that. I had no complications whatsoever. However, it only lasted for 3 years. I did have some numbness, which, you know, a lot of people choose an MVD because they don't want the numbness. I did end up with numbness on the side of my face, but that was an easy trade-off for me. I had no problems with that. But again, 3 years later, I began the pain again. So I was back on the Topamax. I believe I started with 200 milligrams. But again, years went by and I had to begin upping the Topamax. So I got to the point that I think it was maybe 4 or 5 years later, I reached a level of 400 milligrams of the Topamax. And this last fall, it became unbearable, almost to the point of what we were discussing. I wasn't ready to commit suicide, but I was on the couch for the last 6 weeks prior to having the procedure that we're going to talk about. I could not eat. I could not drink. They had put me on, my neurologist had put me on Robaxin, which Lynn said had helped her a lot, which is a muscle relaxer. It helped me for 2 weeks. I called the neurologist back and said, it's not helping anymore. They then put me on Tizanidine, which is a stronger muscle relaxer. Helped me for 2 weeks, and then I was back to square one again. I had gotten to the point that I was losing 1 pound a day. I couldn't eat, I couldn't drink. I knew I needed to be in the ER, but none of us want to be in an ER right now. I needed a food tube, I think, and I also needed hydration, but I couldn't go into the ER. That's how I looked at it. I didn't want to be in there in these situations right now with what's going on. I just didn't know what to do. So they directed me to a surgeon, and they said to seek what your options were. So I sought out the help of Dr. Malik, who is a surgeon that I was familiar with. My prior surgeon, unfortunately, we lost. He was wonderful, but he passed away at a young age. So Dr. Malik is watching something else that I have going on, and unrelated to this completely, but he gave me 3 options. He said we can either repeat the MVD, which he was not in favor of doing. he said that we could do Gamma Knife, but I was too desperate and I needed pain relief immediately, which if you're familiar with Gamma Knife, you don't get immediate relief. Or we could do what was called a rhizotomy, which I had heard of, but I didn't know much about. And what I did know, I was fearful of, because I had always heard it was a procedure that you needed to be awake during, and I didn't like the thought of it, and I didn't like the little bit that I did know about it. But I also knew that I was desperate. So he explained it to me, and he said, you're already in so much pain that what's wrong with going through a little bit more pain if it's going to get you out of pain? So I put my faith in him because I knew wonderful things about him. And I also put my faith in his nurse because I know her very well. And she said, you need to trust him. He's going to help you. With the rhizotomy, the figures that he gave me were I had a 70% chance of it working and a 3% chance of the pain getting worse. Of course, the 3% chance scared me, but the 70% chance sounded great. I mean, 70% isn't 100%, but it sounded like a lot. And he seemed very assured that he could help me. So I said, I need to hear more. And he said, let me send Lynn or Tony, which is his nurse. And she came in and she explained it more to me. And she said, go home and think about it. And I went, I don't need to think about it. I need to do it. I just knew that I needed to do it. So I said, how soon can we? And she went and she looked and she said, we can do it in 2 weeks, which to me sounded like 2 years at that point, but as soon as they could do it. So the 2 weeks went by, and even that was a load off my shoulders because I knew that we had a plan. And just to have a plan at that point, heaven, it was heaven to me. So the 2 weeks went by, and I became excited about it. I mean, as nervous as I was excited knowing that there was hope. And I think that anybody that's in this much excruciating pain, hope is what you need. Hope was what I was given that day, and it was all I needed. So the day came, I was scared. I mean, I admit I was scared. I read more about it. I mean, I don't know how many of you have this book that, you know, is our Bible, the Striking Back book. I read more about it in there, and it kind of made me a little more nervous, but I mean, knowledge is what we need. You know, I read about it. I knew more about it. But I was still excited. There was maybe a chance that it was going to get better. So I got to the hospital. I was laying there. In here, it tells you that they're going to give you something right away to relax you. Well, they didn't, you know. They weren't sure when Dr. Malik was going to get there. Apparently, he was running late that day, so they didn't want to give me something to relax me. And then it was gone before he gets there, you know. So that was the unfortunate part. But he ended up getting there sooner than they planned. So I had talked to, they said the anesthesiologist was coming in. Well, it turned out to be his son, they said, you are so lucky to have him. So I talked to him and I said, I am so nervous. I think I have PTSD from a prior situation. I'm also a cancer patient, and I had to go through something that was horrible, unfortunately, with that. And I said, it's kind of left me scarred for pain. So I conned him into giving me something that not all patients get, and it helped me so much. So they get you into this room, and I mean, it's filled with people, and whenever I have any procedure done, I get in there and I'm just thanking everybody, and they're all laughing. Thank you for being here. Thank you. I know you're going to help me, you know. And it was wonderful. I mean, they give you something, they put you out, and yes, they do wake you up, but all they need to do is see that they're in the right spot. You're awake for a second, you know, and it was totally pain-free. You feel pressure. They insert a needle in here, the size of the needle. When you wake up and you want to see where it is. It's the size of a pin, you know. I mean, it's so small. 24 hours later, it's gone. The little mark from the needle. It's amazing how small it is.
Mary Ellen, can I ask how you knew that? Like, how do they know? Like when they wake you up,
Mm-hmm.
do they irritate the nerve? Is that what's happening?
It's a little vibration with this needle. It's connected. It's an electrical vibration, and they know, they want to know that they're in there. And yes, all I can say is, yes.
Okay.
There was no pain. If you can con your doctor into like I did, I felt no pain at all. I only felt pressure, and I felt the pressure in this area because that's where, and I said that to him. He said, "Are you feeling pain?" And I said, "No, I feel pressure." And he said, I would expect you to feel pressure there because that's where I'm working. So yes, you feel a little vibration of the needle working. And it's heat, I felt no heat whatsoever, but that's what they're doing, is burning that nerve to a degree. They can't do it completely or you would be droopy faced, but they burn it enough to numb that nerve, or to deaden that nerve. They're not numbing that nerve, they're deadening that nerve. And you end up numb. I am numb. And the total numbness only lasted, I don't even think it lasted a week, but from my lower lid all the way down to here. Now, if I feel it now, I feel it numb, but I felt it like without touching it numb for like the first week. And then they did that maybe 3 times where they woke me up, but I can't tell you enough that there was no part of it that was uncomfortable for me at all.
What did he give you? Do you remember? What did the anesthesiologist give you?
I think that it was, what's the one that begins with an F? And I should have written that down. The real strong.
The propofol? Is that what you're thinking of?
Fentanyl.
No, fentanyl.
No.
It was fentanyl.
Okay.
Yeah. Which they don't normally do. And Dr. Malik had refused it until I begged for it. And
Yeah.
my son went and said, talk to my dad. But it was because I was so on edge about it due to prior experience that I had.
Yeah.
I don't know if he watches this, he's going to say, why did you say that? I don't know that he didn't want to do it. But like I said, I really think that I have some PTSD due to the prior.
I think I think all of us have some degree of PTSD every time the wind blows. I was told I might be in a little more but it worked, and he was able to work with that. So I don't understand. You are so brave. You are so brave, girl. That's so cool.
But and then after, in the recovery room, prior to it, they ask you to open your mouth wide. I think they want to see just how wide you are able to open. And then post-op, they ask you again in recovery to open your mouth. Well, I know it wasn't as wide as I was prior to it.
Sure.
So that's part of a result of it. But within, I'd say 6-7 weeks after, it's the normal again. It's just a recovery process. And I also had a little bit of a crossbite after it, but that all goes away within 6 weeks. So that's all a healing process of it.
Sure.
So worth it. All I can say is I woke up pain-free, and I was, like I said, I couldn't even put a glass of water to my mouth. I had a hard time taking my pills because I could not touch this lip. So how do you drink? People would say use a straw. You cannot use a straw.
Syringe.
Well, that was it. I was trying to you can't even do that. My husband was trying to, with a straw, put liquid into my mouth, but you can't take a pill like that,
Right.
I couldn't do anything.
Oh.
Be in the ER being hydrated, and somehow it was, I was at the worst I had ever been. And I woke up totally better. 100%
amazing.
better. They said to be off my pills, but most of us, when we have procedures, don't get off of all our pills because we're afraid.
Yeah.
I'm down. I still take 100 milligrams. And I did after my MVD too. It's just security.
100 milligrams of
Topamax. It's just security.
That's
Yeah.
That is such a great outcome.
I would recommend. My husband just keeps saying, I don't understand why people aren't doing this, because he just sees how I went from my deathbed. I did not get out of, I got out of bed, but I didn't get off the couch for like 2 months,
Mhm.
couldn't move. I couldn't touch this side of my face because the little bit of vibration of just going like this would trigger a spasm on this side. It had gotten so bad. I mean, I never dreamt that.
Was your pain in V1 or V2?
It had moved up to V2.
It was in 3?
No,
Original?
it was down here.
3,
It had moved
yeah.
up. This is 1. If you look it up, I always thought it was
No,
the
one's up
opposite.
at the eye.
That's what
No, one is your eye. One is
Yeah.
your eye.
No, one's at the eye.
Well, then I Googled it today to make sure. And then when I Googled it, it showed 1 down here. I always
Okay.
thought it was 1, 2, 3, but I
Right.
Googled to make sure. And
Anyway,
maybe the internet's wrong because
Yeah.
the internet's showing 1, 2, 3.
yeah,
I always thought it was the opposite,
yeah,
but
it was. Yeah.
whatever. I started
Yeah.
down here. It had this year moved up
Moved up.
to this.
Okay.
Yeah. Yeah. I
Uh,
was confused.
Just
Has it ever gone on the other side, Mary Ellen?
Never gone on the other side. And it's not going to.
That's right. That's exactly right. Oh, that's such a great story. We're so happy for you.
Yeah, Lynn, we're fortunate
Yeah.
that Lynn had this idea that we have Mary Ellen talk, because when we met in the conference room again, Mary Ellen was with us most weeks for many, many years. The one thing I would,
So many people.
yeah, one thing I would comment, especially for those of you, I don't see New Zealand hooked up this month yet, but unless she's on there someplace that I don't see her. But one concern I would have, being the co-leader with Lynn here, is be sure if you consider this condition, especially if you're not in Michigan, that you get a neuro that has done hundreds of these. Maybe not yesterday, but in their process, because most neurosurgeons are educated, thank God, to know that they're probably, well, maybe it's just Tim's mind, they're the closest thing we have to God, I think, because of all the procedures that they do, such as this one. But Dr. Malik does much more complicated ones in the brain than this one. So he's done one neck surgery on me. My ATN is not applicable for the procedures. The procedures aren't applicable for my condition. But if you guys out in California or wherever, Rachel in New York, you consider this. Hi, Susan. Please quiz the doctors. I know you've got Mark Linsky in Southern Cal, who's done many procedures. And I think the people that have had him in the Orange County support group have great.
He could probably.
Yeah, I think he's done them. Have great. He does a lot of pediatric. God bless him. Which I'm not sure we have any neuros here that touch pediatric. So you've got Mark Linsky out there who spoke to our group sometime last year. That's my only caution. The one downside that there's 3 needle procedures. Again, one is a glycerol, one is a balloon compression, and the other is I call it a heated needle. One concern I have from that, if not done correctly, I ran into a young lady once at one of the conferences who had this done without saying by who. It wasn't Dr. Malik. Ended up with anesthesia dolorosa, which is
That's the 3% that could make it
could
worse.
be,
Right.
which is my definition is a painful numbness. So you want to avoid that. But again, like Mary Ellen said, that's only 3%. So that's why you want to quiz a neurosurgeon on how many they've done. Any surgery you go into, there's always a low percentage of problems. Without getting into detail, things can happen. Anyway, I think that's the only thing, Lynn.
Ben Carson would have been our pediatric neurosurgeon.
Yeah.
Right.
And he joined the wrong political organization. Sorry about that.
Oh.
Yes, that's bad, Pete. I know. Anyway,
You got 2 strikes, Tim. Just letting you know.
I get 3. He's going to shut my picture off.
You're gonna red card.
Leave Mary Ellen off. She'll just push me over in my chair. But you can see how beautiful Mary Ellen is. That the numbness is not resided in her. We've been wearing masks. We've been wearing our masks prior to our getting online. That's how safe we're trying to be from COVID here in Michigan. At least
so bad.
Yeah, it's bad in Michigan.
It's bad everywhere right now.
That's a good point that Bill made, that the San Francisco area is highly vaccinated. We're headed south. My son's in Atlanta and Florida, and they're the worst in the southeast of the U.S. for vaccination. So we'll be double masking probably down there. I have relatives in Southern Cal as well. In I forget which city it is, but I've been there. Anyway, Lynn, anything else to add there?
Excuse me, Lynn. As we're running question and answer phase now, and again, welcome all to the newcomers that came in since Mary Ellen had started. This meeting is recorded, and we're just trying to be clear for you to protect your privacy. If something that you don't want recorded, please raise your hand. Let us know. We'll pause it for that time. Yeah. Again, resume. Just want to keep you all protected. Thank you.
I have a quick one. I was wondering, Mary Ellen, can you speak about your recovery? Like, how long were you in the hospital? How did you spend the night? Can you speak on that?
No, you just spend a few hours in recovery. I was home that day. It's very quick recovery. And, you're on soft foods that day. And like I said, you don't have, your mouth doesn't open quite as wide for a while, but I think that's different with everybody. I mean,
and it even happens with the regular dentist when they give you a block, that really gives you that trismus in your jaw joint. So that's totally normal.
And like I said, I did have a crossbite, but it was funny because it was a crossbite when I would open wide. I opened to the right. But I still, when I closed, I had a normal bite. When I closed my mouth, my teeth met properly, which was, I found kind of odd, especially having worked in a dental office for a few years when I was younger. I didn't cross-side, bite or cross-bite. But when I opened, my lower jaw jetted off to the right. But like I said, by maybe 6-7 weeks, it was gone. So all that was it's a recovery process that was kind of strange. But
you had it done before Halloween, right? And I remember seeing a picture of you
October 4th.
Okay, I remember seeing a picture of you a couple of weeks later, and you couldn't tell at all, that you were numb or.
No, you couldn't. You really, it wasn't visible. You could hear the crossbite. I had to lisp a little bit because when I was talking, it was the side, the crossbite was up, kind of, you could see. But like I said, it was gone in a matter of less than 2 months,
That's incredible. I think a really good point you made was that you got to this point after having been well controlled on medication, and then the MVD working for 3 years, and then titrating up in the medication, and then all of a sudden it just went gangbusters. And you, at that point, you had already researched your neurosurgeon. Thank goodness you knew Dr. Malik well.
Right.
And how competent he was. And you really didn't have many other options.
No.
So there's no sense drumming, getting every little tweak answer out when we just need to follow through and
exactly
cure this thing.
Yeah. I would have known more about it. I would have felt more intelligent saying we're going for it. Because usually that's how I am. Not that I'm intelligent, but I like.
Yes, you are. Yeah. But no, I understand that.
You get more, but I just was so desperate that I went. I do this, like I told you.
Right.
I knew I needed to do it, and I did put my faith in him because I respected him.
And you were already his patient prior, so that's another tip for everybody to get into the neurosurgeon you think you would want to do a procedure. And God forbid you decide to do it, you're already lined up.
Right.
That takes a lot of stress off of
thinking that you might be interested in the future.
Right. Yeah, and get a consultation.
It's not something that you want just anybody to do.
Yeah, it doesn't work on patients that have the constant burning, but the type 1 sharp stabbing electrical.
Well, and spasms,
Yeah.
because I definitely get spasms. And then
Yeah.
I got spasms more than I got strikes. So it works out.
Wow.
I think
Absolutely. That's why I was
Yeah.
going with the muscle and asking you
Right.
about
Yeah,
muscle.
no, it helps me too. Yeah.
as background, Lynn is a nurse, a registered nurse as well, and she's been invaluable in terms of medications
I
for
knock
our
on her
members.
door all the time.
Yeah.
Oh, likewise.
I
I call Mary Ellen my big sister. She's been through cancer and I ended up doing that too. So
for sure.
you bond over all this stuff.
Yeah.
Dr. Malik is Dr. Gauss, Ghaus, Malik, and he's located at Henry Ford, West Bloomfield. And he hasn't said he's going to retire yet, so we're hoping he sticks with us. But we all age. The one other thing I would add is historically, Lynn, the neuros had said on the needle procedures, the 3 as I call them, needle procedures, usually last on average from 6 to 18 months. But many people have gone much longer than that. Mary Ellen, he
said anywhere from 3 months to years. Those were his words. And he said, he just can't say because everybody is different. So everybody's nerves rejuvenate at a different pace. So
Right.
we just don't know.
Okay.
So
I read briefly on the facial pain website on the ablative procedures that this can last up to 8 years.
Yeah. Wouldn't that be wonderful?
So that would be wonderful. I know I get the same procedure for my back. And it's helped tremendously.
Well, add to
I
that,
have read that, Bill, and I just can't believe that it would last that long, but I have read that it can.
but the advantage of this procedure is it can be redone. There's no, unless you build up too much scar tissue, I think, Lynn. But like with your back, they can redo it, right? There's no limit.
Oh yeah, I've had it done every, you know.
Same with the face. Supposedly
right.
they can do it.
And it's definitely, having gone through it once, it's definitely not something that I would not want to do it again.
You would do it again.
I would absolutely do it again.
Yeah.
And
that's fantastic. I know that Dr. Casey had done several of these. I believe it was the glycerol ones he did for Nell Scribner and Lana Updike, and they got in so much pain in the hospital they couldn't go on. And he said, "This is what you need." You know.
Now, again, if
he
I
really helped.
Have what his wonderful son gave me, the fentanyl, I would do the glycerol. But I have heard, in fact, I think it was Dr. Malik that said it, that the glycerol is more painful to go through.
Right. And that at one point they weren't even able to get enough glycerol.
I remember hearing that at one of our meetings.
Yeah.
You have to sit upright for so long, for 45
right, to bathe that knuckles cave in the glycerol.
Right.
Where the heat, it's automatic and it's very well controlled. I feel very confident having that done in my back.
Pain for months, then to sit for 45 minutes, I guess you do it. But
right,
are they able to medicate you with the glycerol or no?
Yeah, they do the same thing.
Yeah.
Yep.
Dr. Copeland in Midland, before he passed, that's all he believed in when he came here from California.
Right, that's right.
So many glycerols out there. He was doing those in lieu of the MVD, and he was passing patients who wanted the MVD on to Dr. Malik and Dr. Piper. Unfortunately, we in Michigan have superb neurosurgeons now, but we've lost 2 of our most competent ones to various conditions. One to cancer and one to, it was a long-term issue.
Yeah.
From in Midland, but he had done hundreds of the glycerols. But like you say, Lynn, I think they're having trouble getting it now.
Supply chain is bad all over. It touches every industry.
Even before this, they were having trouble getting glycerol.
Right. Where was Dr. Copeland practicing in California?
I think it was Scripps.
Okay.
It was Scripps. Yeah.
Okay.
Does
anybody else have questions for Mary Ellen? Or each other?
Yeah. Yeah. Crosstalk, any crosstalk. Everybody got the note that we sent out. What you'll see is that on February 9th, Dr. Malik has been willing to speak as a follow-up to Mary Ellen and talk about the procedure and any other procedures. In March, Dr. Jason Schwab, who's a partner of Dr. Malik, I didn't realize this, Lynn, he's going to cover the 11 different procedures that he does, both TN and stimulation.
That's
And
fabulous.
April 13th, Dr. Oren Sager, neurosurgeon at the University of Michigan, who spoke to our group a number of years ago, is going to talk about what they offer at the University of Michigan. Go Blue. And Lynn and I both have tuition. I have, oh Lord, 12 years of tuition.
Well, I paid that tuition too.
Yeah. 12 years of tuition out at Michigan, and Lynn has at least 4. So we're, yeah, that's a good balance. Michigan State. My wife said we have a mixed marriage because my son-in-law was captain of the football team at State. So we've got both sides of the family here. We also strongly encourage you to register for the 2-day conference that the Facial Pain Association is going to put on January 29th and 30th. And I think the ticket's only $35. So you get to talk to all of the great experts. And Rachel, in New York, I'm not sure Dr. Casey somebody will cover his disability perspective. TN, you can probably speak to this better than I can, Rachel, but effective January 1, 2022, TN has been added to the quote unquote blue book, I think, Rach, for medical codes and trigeminal neuralgia. Before, they couldn't find the damn thing in the codes. And effective the first of the year, they should be able to have it. So if you can't find it, get a hold of us and we'll try to help you out on that. Anything else there, Rachel?
No, that's very helpful. And I also wanted to say to Mary Ellen, thanks for sharing your story. I have never heard of anybody getting that done. And it was just really nice to hear your perspective. And I think that I would definitely need the fentanyl to get through that.
Yeah, definitely. And why not? It's not anything.
Dr. Malik might be mad, but
I mean, obviously I can't compare because I haven't had it done without it, but it made it, I don't want to say it made it a pleasure, but it was painless. It honestly was.
Oh, that's wonderful.
Like I said, I would have it done in a heartbeat because there was just nothing painful about it going through the procedure.
You sure it was fentanyl?
No, that might help too. But
if it's something that, we as sufferers may have to do multiple times throughout our life, it's so good to know that that's available.
Right. And how quickly it can be effective. Like the gamma knife taking up to 6 weeks.
Right.
You can't tolerate that.
No, when you do gamma, you need to come to the table way before I was.
Right.
Like, get relief, you need that relief. You can't wait.
Sure.
Weeks,
Just as a reminder, the MVD is looked upon as the gold standard if you have a good neuro and if you have the an excellent neuro, not a good neuro, and your symptoms are applicable to the MVD in the TN1 condition. If it's a TN2 and beyond, they'll give you a 50-50 number probably. So this might be an option you might want, because usually most neuros are avoiding a second MVD for good reason. They're worried about scar tissue and causing more problems than you might have. But again, if you
so
can
much
hit
more invasive.
Pardon, Rach, I'm sorry.
MVD seems so much more invasive than what Mary Ellen had.
Right. Definitely. You're in the hospital. Well, every neuro is different. But when I say neuro, I apologize. I mean neurosurgeons. They vary from 2 days to 4 days. I think Dr. Malik, it has a longer recovery period than some of the younger neurosurgeons. But anyway, The other thing is there's numerous, if you haven't been on the Facial Pain Association website, they have various other webinars on there. And again, recommending contributions to Facial Pain Association. One of our members has been giving money and not receiving the FPA journal. They send out a journal 4 times a year. So, and with very valuable articles. So be sure if, I forget, Lynn, do you remember if you had to give $50 a year or something?
It used to be that, but I'm not sure that that's the case. We have one question we'd like to get to. Roseanne, would you like to ask that?
Hi, thank you. Mary Ellen, your story is inspirational, and I hope that we have success too. My husband is a trigeminal neuralgia sufferer, and he is 3 months post-op of the MVD, and it didn't work. It didn't work at all. So he's still getting the pain, but I just have a question out for the group who has ever had if they have had the MVD. He's saying now that his pain, where it used to go from across his face to his mouth, now his pain is in a different spot, and it goes from his eye along down his nose down to his mouth. So the pain changed direction, and he said it's a different type of pain. He has mentioned that it's more intense, and it is a little bit more frequent. So he has not gotten off any of the medications. He's on 3 medications right now. We have not been able to wean. We decided early on after the 2nd month, like we kept calling the surgeon, and he said everybody's different. The nerve, everybody reacts differently, to wait, to give it time due to swelling. He had 3 weeks post surgery with no pain. As soon as he stopped the steroid, the pain, this pain came right back. So we, of course, we weren't hopeful after 3 weeks, but we kept saying, okay, give it the time, give it 2 months. Then now he's 3 months, and he's still, again, getting the pains, but it's in a different direction. Has anybody heard of that happening? We are seeing the surgeon again in February, but I'm also I've already contacted Dr. Jeffrey Brown. He's in Long Island. I live in New York. And we're in the process now of filling out, I just contacted him this week. I could see him as soon as we get our paperwork in and all of the, operative notes from our surgeon. We were very confident in our surgeon in New York. He's from Weill Cornell. He's done hundreds of the MVDs, and, we are confident in him. It's just now I'm seeking a second opinion, because now the pain, I'm worried, of course. I'm worried. And, my husband did say, though, that the pain is in a completely different direction. Has anybody heard of that or experienced that, or has any knowledge about that happening post MVD?
Can't say that I have. Dr. Brown, of course, is very good. I would absolutely back going to see him. He's one of our people that came from Michigan, actually.
Yeah. His book, I don't know if you've seen his new oh wait, this is Dr. Oz, wrong cover. But Dr. Brown does have a neuropathic facial pain book out as well.
Sorry.
I can answer.
Okay.
I've had a few MVDs, unfortunately, some successful, and then not. So, and I also have bilateral TN, but this last one that wasn't necessarily successful, I manage pain, but it's medication that manages it now. It changed afterward. Like at first it was numb, and then it completely changed. Like sometimes it's here and sometimes it's here, where it always was in a different spot. It's not necessarily more intense because it's always just terrible, but I seem to manage it with medication. So
do you use steroids on occasion too, Maria?
No, not oral, no oral steroids.
Okay.
just really carbamazepine is the only, or Tegretol would
Yeah.
be the only thing that helps me really.
Yeah.
Have you
Did the
tried
doc-
Neurontin at all, Maria?
Pardon?
Have you tried Neurontin at all?
Yeah, in the past.
Too strong.
Right.
Yeah.
No, it's not too strong. It's just Dr. Casey, who's my physician, my neurosurgeon, didn't feel I had the right style of pain. You know, they try to
Right.
they try to give you a medication that's going to match what's happening. And the Tegretol works. My problem is side effects from it. I have to manage those.
Yeah.
So
Did the doctor give you an explanation of why the pain changed in the area?
no, he
Okay.
said when you're irritating the nerve, because even though they're very careful and they're not moving it around, they do, of course, disrupt the flow. And what's supposed to happen is it's supposed to stop the pain. But I think sometimes, depending on everyone's physiology, it just might just find a new route.
Did yours work for a while, Maria?
No, the third one, no. The one on the right side, never, no.
First two.
Yeah, the first two are good. That's the left.
Oh, okay. The other
Yeah.
side. Okay.
Yeah. I heard, I joined a support group meeting. I think it was something from the facial pain did. It was with Dr. Linsky. This was back maybe in the spring.
Yes.
And I asked him, because I have these side effects from the medication that are terrible. I have really, really low sodium numbers. I told you my sodium numbers, you'd think I needed an emergency vehicle, but anyways, I'm fine. But he suggested to have a repeat MVD. And I said, that would be my fourth one. I mean, really, I'm not,
Wow.
I just don't, I can't even, I mean, it's just terrible. They're not great.
Who suggested that?
Dr. Linsky, but he was suggesting for me that because of my age, he said, you're not yet 60. You want to not be in a spot where you can't get one because you're elderly.
Other issues. Yeah.
Yeah.
Heart, et cetera. Yeah.
Yeah. But what Mary Ellen's describing sounds like something I'd rather,
Right.
even though I don't want to go through any of it, it's something I would consider probably first.
Yeah.
Good,
Especially after.
Yeah. Consult with doctor. You're right here in our area. So
Right.
yeah, you could consult. Tony is that she was saying how great she is, won't be back until January 17th, but you might be able to reach Dr. Malik because he's responding to me on email.
Mm-hmm.
You might be able to get somebody over there. It's 248-661-6417, I think. 248-661-6417.
Okay.
I believe it's neurosurgery at Henry Ford, West Bloomfield.
Mm-hmm. Okay.
And it's not this. Yeah, it's only the 12th. Yeah. So she's probably back next Monday. But I'm sure somebody can help you there, get you through to Dr. Malik. And if you have any trouble, Maria, let me know.
Or Mohammed. He's
Okay.
good.
Mohammed,
too.
right,
Yeah.
right.
It's nice to see successful procedures that are in and out. You're not in the hospital for a couple of days, especially with
Right.
the pandemic going on and
Felt
such.
okay after. Yeah. I mean, there was just no recovery time. You're honestly
Yeah, that's huge.
trying to ice it, but
Yeah.
it was so easy. It really was.
That's great. Does anybody else have any questions? Speak up if you go right ahead.
Waiting. Sorry, you have any more, Roseanne?
I actually have another question. What do you do about when you do have to do your routine dental cleanings and whatnot? I mean, I know my husband took a painkiller, took a tramadol, but is there anything else that anybody's like? We're new to this because when my husband fell, he was injured. He slammed his face on the ice and injured his whole right side of his body. The trigeminal didn't occur until after he had a double wrist surgery because he tore both ligaments in his wrist. and he was controlling it for 5 years with medication only. And then last year, 2021 in July, woke up in the middle of the night screaming in pain. And that's when it started again. So we had the surgery in October for the MVD. We went to 3 surgeons. They all suggested MVD. We went with the surgeon we felt most confident in. And he is dealing with it. I have to say the medication for 5 years did work. Now we're in the process because now the pain is just constant, and he just had the MVD. And like I said, it's not successful. But, brushing teeth is an issue, of course. He tries his best, but that doesn't always work out. And he went to the dentist, and, that's where we are new to that, this whole I don't know the word for it, disaster.
Yeah, we haven't figured it out.
I'm sorry, it's just lack of words at this point. Just fear. And,
have they tried using nitrous oxide, Roseanne, with him, like the laughing gas or the lidocaine? Sometimes they, have to work in just a quadrant at a time for cleanings and numb them up. Mm-hmm. And make sure you go on days that there's not a storm. Take your breakthrough medication. Sometimes they say increase your baseline, just for a dose or 24 hours with your doctor's permission. But that can kind of get you over anything that, increases it. And try not to, you need to maybe schedule a longer appointment so he can close his jaw in between, because that's really hard on the jaw. So those are a few things that I used to work at U of D at the dental school before becoming a nurse. So those are some of the tricks. But I have lidocaine liquid at home that I use when my teeth hurt. And
I honestly have a fear now that to go, and my brother is a dentist, as I mentioned. He's not anymore, he's retired, but I fear now of going to the dentist and I'm pain free, but
the trauma.
So it would trauma, but I keep thinking, okay, Mary Ellen, that nerve is dead, or partially. How can a dental procedure, it can't wake it up, can it? It's like, do I need to call Dr. Malik and ask him that? Because I kind of am due, and I think, should I go or shouldn't I go? I don't want to, you know what I'm saying? Yeah. We all have these fears, either we're in pain and we can't go, or we're not in pain and we don't want to cause things,
Right. Isn't that
like
true?
6 of one, half dozen of another,
Roseanne, did you say the pain is constant now?
Well, he is on full medication, so I wouldn't say constant, but as soon as it's time for that next dose of meds, he's feeling it. He's feeling it in the middle of the night, which I have to say he never has. Not constant, it depends. And so he did. It is more than than he has felt. Yes.
What are his triggers, Roseanne?
Life, just chewing, brushing teeth, at all the same, common triggers.
I asked him
sometimes no trigger at all. He's just sitting there.
I asked because
baby toothbrush, a soft little.
I've gotten him soft toothbrushes. I've gotten him the brushes that you could just like swish in your mouth, not a brush, just like a sponge.
You have the lidocaine from your dentist, the viscous lidocaine.
Okay.
That's the topical, and he can squeeze that in the area and just swish it around, wait for it to get a little numb, and then try to brush. I know at our house, even just the fan of the furnace will trigger my face pain. Or if we have a leaky window or something, I'm the first one to say we have a draft, and Pete's hypermedically sealed our windows and switched the fans off and things like that have really helped.
He could just be sitting on the couch and it just overcomes him. And for no drafting or nothing like that.
Does heat help him, or cold, or either of those help at all? You know those little hot packs you can get like for your gloves?
Yes, he doesn't want anything on his face. Like I have to say right now, he's of course very depressed because it's, he's so optimistic with the surgery.
Right, sure.
So he wouldn't, he can't even come on the group meetings with me. So that's why I'm
I understand
him. But he goes in the other room. He doesn't want me seeing him in that bout of pain. But he doesn't put anything on, but he lives for that. That's 6 o'clock or 6 o'clock dose of medicine. He lives for that. Yeah, he just tries the best to get to that 6 o'clock.
Yeah. Does he have breakthrough?
Yes. Mm-hmm.
Go ahead and ask her.
It sounds like the meds really are helping him though when he takes it.
So that's what. I mean, as I said, they always did. He was only on carbamazepine for 5 years, and then July 2nd, when it all started, it just took that turn, and now he's on latromagen, carbamazepine, and baclofen. Yeah. And I'm not going to say it's every day. Like I do work, so I don't really see. He's retired. He was forced to retire. He was a New York City police officer, and he is retired. And he doesn't really say much. I do have him, writing in a journal, and he only shares that journal with his doctor. He just doesn't want, to burden me. Of course, I see the pain on him sometimes, but he doesn't want to burden me with it. But there's days where, I notice I'm like, oh, it's 6 o'clock and he didn't take the medicine. And I'm like, and I don't want to keep asking him or keep on him because
right.
That's his way of dealing with it. And I have to respect the way he's dealing with it. And I'm like, oh, it's 6:30 and he didn't take the medicine. And it's like, that's a good night, and we celebrate those nights. I'm like, wow, this is awesome.
Yeah.
But, I notice, of course, in the morning, it's the worst. When he wakes up, he needs to take his doses. And, when I said, when it comes time between 5:30, I start getting on edge. I'm like, do you want your pills? Do you want your medicine? Should I get them for you? And he's, he just says, please just back off. And now I just back off and he gets it when he needs, he gets it. He's very capable. I'm just a very nervous person. So, I just want to be on top of it.
Yeah. Yeah.
Roseanne, Tim, will you email me separately to discuss opiate uses? I think we need to have a conversation offline about that. If it gets any worse, or possibly now, we can talk about that. Again, any other questions before you want to ask Mary Ellen anything else? Oh, go ahead.
I have one. Hi, is there snow on the ground?
Yes.
Like I told you, it's a bitter cold. It's worse.
Tonight, a little dusting.
You have to rub it in, Susan.
I do.
I know. No, it's California. He's
My
from
nephew
Michigan.
just moved here from California.
You did?
My nephew did.
Oh, your nephew. Okay.
Wow, what is he thinking?
Do you know where Carlsbad is?
Yes, I love Carlsbad.
That's where they came from a couple
down
months
by San Diego. Oh, he's going to have a hard time.
Yeah. Well, he's from Michigan, but she's not.
Yeah.
But he's been out there for about 15 years, so he just came back home again.
See how long she.
Wow.
Yeah, I know.
I'm sure you're happy.
We are very.
Yeah.
Yeah.
That's cool.
Kids, so yeah. My brother.
Oh, that'll be fun.
Brother's gone. Unfortunately, we lost him, so I feel like I'm the grandma here for them. Yeah.
Aw.
Yeah. So
you'll do a great job being grandma.
Oh,
that's so nice.
Yeah. Just a couple last points if nobody has any more questions. Consider, I think I mentioned that, contribution to the FBA, and be sure you get the quarterly journal. The last one was excellent. Talks about
it's also online.
Yeah. She's an online person. I'm not. So I have to have a hard copy, being the older generation than Lynn. So try to get that hard copy if you can. Also, I probably haven't emphasized it enough. The Facial Pain Research Foundation has, 10 or 15 projects going around the world researching, looking for answers to our condition. And unfortunately, their leader's wife Mike Pasternak's wife has had some challenging health issues, so he had to back off. But if you want to know about those projects, or your local neurosurgeons want to know, they can look up the Facial Pain Research Foundation. We also, thanks to Pete and my son-in-law, we have at least 30 past speaker videos on YouTube. And if anybody wants, we don't have much expense, except I do mail out, which isn't that much. I think 11 agendas to people who don't have computers. And I want to also thank Pete. We wouldn't be meeting for the last 2 years if it hadn't been for Lynn's husband, Pete. The only bad thing is she makes him go to the basement. She locks him down there for the hours. At 45, the screen comes on and Pete has tears in his eyes, but he gets over it. And
Tears are highly overrated.
she lets him back upstairs by 11 to watch the news, I think. So anyway, thank you.
Hey, it's the lower level with the water feature. It's not so bad. It's a sump pump. It's a man
I love
cave.
my freedom at 11. It's a flag.
Yeah, keep that pump going, Pete.
Otherwise, I'll drown. Yeah, I want to keep that pump going.
That's right.
Anyway, thanks all for joining us and for Tim's bad humor. I appreciate all of you
You are
sharing
awesome.
between each other.
We love you,
And
Tim.
Maria, weren't you the one that recommended Doctor from U of M?
Yeah, I had been given his name by someone
Yeah.
that had he's not, I don't know the individual, but he had an MVD and said it was successful. So I thought, well, I'd never heard of him. And my worry, Tim, is that, like you said, here in Michigan, we have some great doctors that have a lot of experience, but they're not getting any younger. And I don't know who's coming up behind them. And
not many.
Yeah. And so that's a concern that we start as a group, just to look and get other doctors to come in that perhaps are either treating trigeminal neuralgia or starting to see cases, because as they do that, they will become more and more knowledgeable. And then we can even direct them to things like the Facial Pain Institute. Because if you're on the Facial Pain website, which I am, and you try to find a doctor in Michigan, only Dr. Casey pops up. So
that's unfortunate because we have two other ones at Henry Ford. Dr.
Yeah, but they have to pay to be on the website.
But they have to pay, they have to contribute, and they have to, and Dr. Casey regularly contributes to that magazine, and other doctors do, like Dr. Linsky, Dr. Brown, all, you see the same names over and over.
Right, exactly.
If we as a group could get more, information out there to these neurosurgeons to say, like, if, you got to get in these magazines and you got to start, you write, especially University of Michigan, they're writing research papers for that place. May as well write it for the facial pain and get in there. So,
and
Dr. Orange Sager, he's the one going to speak in April.
Right. So I'm just curious as to what kind of experience he has. Yeah. I'm curious to see how many people he treats. Just what are his views? It's
yeah, he's done a phenomenal job helping that one gal that we had a really hard time figuring out what was wrong with her, and she had a deep brain stimulator removed and scar tissue bound her down chest from neck down to her first rib, and it was pulling even on her eye sockets. It was so distressful, and Dr. Brown was able to tell us what she needed, and we were able to hook her up to Dr. Sager, and he was able to sever that scar tissue, and now she's got her life back.
Wow.
So yeah.
Okay, well then I think it's valuable to hear from different doctors, even if
absolutely.
Yeah.
That's why, Maria, we put them on YouTube. The one we have a new African-American one at Beaumont. He replaced Dr.
Jacobs.
That did her MVD. Dr. Jacobs. And I'm getting good reports back. Didn't you see him?
I saw him.
Yeah. What
I
did you
was
think?
just a little put off because I saw him when he first came here and started.
From Mayo Clinic. I think
Right.
he came from Mayo Clinic.
And I was impressed with all that. But I had to wait almost 3 hours to see him.
Yeah.
And
Wow.
yeah, and there was no apology when I got into the room. And
Yeah.
I'm sorry, but that put me off.
I'm sorry I asked you.
I know. It just irritated
Yeah.
me. I mean,
I'm sure it's
I'll
settled
wait
down.
3
now.
hours for
Yeah.
a good doctor, and he may be a good
Yeah.
doctor, but I still expect I'm
Yeah.
sorry you had to wait,
Yeah.
you know?
There's
that just irritated
okay.
me.
Yeah.
Well, maybe he'll talk to our group someday.
He
He
has.
did.
Oh,
He
has
has.
he? Okay,
Yeah,
good.
he
He
has.
did.
He should be on one of the. I think my son-in-law has put that on YouTube. We also have, as I started to say, Dr. Jason Schwab, who's younger and does 11 different procedures,
And what's the lady's name, too?
and Dr. Ellen Ayer, AIR. She's younger. She came from University of Cincinnati about, I don't know, 5-10 years ago. She's also one of the speaker videos on YouTube. But that's an excellent point, Maria. Lynn and I have often talked about that. We've lost 2 excellent neuros. And then the ones we have, like Dr. Casey and Dr. Malik, are aging, as
Our age.
unfortunately we all do.
Right.
See, Bill
Dr.
Scott was with him. Show
Dr.
your
Guth-
dog, Bill.
Yeah, Dr. Guthakonda at Wayne State
Yeah,
has
that's
spoken to our group before, but Wayne State lost their accreditation for the neurosurgery department. So we are really down in that area as far
I
as,
think isn't he at DMC also? I don't know if that overlaps or not, but
yeah, so, but I agree with you. We need some up and coming neurosurgeons, but I think Dr. Jacobs is our youngest guy out there right
He's like
now.
40, do you think?
No, I
He's
don't
probably-
think so. He might be getting close.
Might be
but
close to
he was
40,
very
yeah.
young, Yeah.
Yeah,
He's the youngest one.
yeah.
Somebody else
Just
saw
a
him.
little arrogant, I
Yeah,
thought,
yeah,
but
yeah.
good doctors are,
That's what I said.
Yeah.
They think they're next to God,
Yeah.
and I think they are too.
Yeah.
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 Anyway, I think that's about it, Pete. Anybody else? Roseanne, anything else? Let's talk offline anytime here.
We will say prayers for your hubby.
Yeah.
Yeah,
And let's say
absolutely.
prayers for Dr. Casey as well.
Yeah.
We're not sure exactly what, but I think he'll be offline for about 6 months. Minimum.
Yeah, well, let's, I hope you guys
Did you say Dr. Casey will be?
Yeah, yeah.
Okay. So
Yeah,
he's
I
ill?
He had COVID earlier last year.
Right.
And it's only a guess that he might have long-term effects from that.
Oh.
He sent me an email, said he'd be offline for some time. So
Okay.
anyway, unfortunately, he's probably top one in the country. Probably done more MVDs. Well, somebody challenged me on that. I used that and I got it poked in the eye on that. I won't say by who, but I thought he had done more MVDs than anybody in the world because he travels the world training people. But I was
Brown and Lynch.
Correctly.
Probably right up there with him.
yeah. I would think Dr. Brown's done a lot. And that's back to the Dr. Brown issue. Like we've said numerous times, all of our body is constructed differently when they put us together. So any of these procedures, thank God we've got doctors that are willing to do it. I can't imagine it having the intellect and the ability to go through that training and then to open somebody's head and know you and God have them in their hands. It's just amazing we have them. Thank God. Thanks, guys.
All right. Thank you guys for joining us.
My
And
wife sitting in the background, Lynn, saying, okay.
all
See
right.
you guys. Yeah.
All right.
Bye-bye.
Thank you, Lynn and Tim.
Thank you.
Bye.
Good night. Thanks again, Mary Ellen.
Thank you.
Thank you for having me.
See you, Rach. Thanks, Lynn.
Thank you.